I appreciate the eloquent comments from my colleague from Oregon and all of his efforts to make sure that we don't take away health care for so many people who desperately need it. And that's really why I came to the floor today, because I spent the week that we were back home, not last week, but the week before, talking to constituents in New Hampshire and listening to what their concerns were. And what I heard was that people were deeply, deeply concerned and very upset by the efforts here to repeal the Affordable Care Act when they didn't know what the replacement meant for them. In dozens of conversations, in roundtable discussions, at a town hall forum, Granite staters shared stories of how the Affordable Care Act has been a lifeline for them, including, I heard from people who say their lives have been saved by the law. And in fact, we can see what's at risk here in the state of New Hampshire, where we have almost 600,000 Granite staters who have pre-existing conditions. We have 118,000 people who could lose coverage. We have 50,000 Granite staters with marketplace plans who are in the exchange, 42,000 who are enrolled in Medicaid, and 31,000 who have tax credits that lower the cost of health care for them. And if that is taken away, so many of those people have no option for getting health care. And what we know now, after we've finally seen the plan that Republican leaders are talking about, we know that those fears were well-founded, that they were worried they were going to lose their health care. Because what we've seen is legislation to repeal the Affordable Care Act that would have catastrophic consequences, not only for people in New Hampshire, but for people across this country. And it's especially distressing that Trump Care, as it's been introduced by the Republicans, would roll back expansion of the Medicaid program, which has in New Hampshire and across this country been an indispensable tool in our efforts to combat the opioid epidemic. In addition, we're seeing that, as my colleague from Oregon pointed out, the Trump Care would terminate health care subsidies for the middle class and for other working Americans. And it would replace those subsidies with totally inadequate tax credits, as low as $2,000, which doesn't begin to pay for health coverage for an individual, much less a family. And this means that as many as 20 million Americans could lose their health coverage. And even as the bill makes devastating cuts to the middle class, it gives the wealthiest Americans a new tax break worth several $100,000 a year per taxpayer. So I think this proposed legislation is totally out of touch with the lives of millions of working Americans, people whose health and financial situation would be turned upside down by the bill. Last week, in his response to President Trump's address to Congress, former Governor Steve Beshear of Kentucky said something that really resonated with me. He reminded us that people who have access to health care thanks to Obamacare are not aliens from some other planet, as he described. They are our friends and neighbors. We sit on the bleachers with them on Friday night. We worship in the pews with them on Sunday morning. They're farmers, restaurant workers, part-time teachers, nurses' aides, construction workers, entrepreneurs, and often minimum wage workers. And before the Affordable Care Act, they woke up every morning and they went to work hoping and praying they wouldn't get sick or members of their family wouldn't get sick, because they knew they were just one bad diagnosis away from bankruptcy. Now, to understand why people in New Hampshire are so upset and fearful about efforts to repeal the Affordable Care Act, we have to look again at this chart, because some 120,000 Granite staters could lose their health insurance. That's nearly 1 in every 10 people in the state of New Hampshire. And in particular, repeal of the Affordable Care Act would very literally have life or death consequences for thousands of people who are fighting opioid addiction, who have been able to access life-saving treatment thanks to the expansion of Medicaid and to the Affordable Care Act. Sadly, one of the statistics that we're not happy about in New Hampshire is that we have the second highest rate of per capita drug overdose deaths in the country. We trail only West Virginia. The chief medical examiner in New Hampshire projects that there were 470 drug-related deaths in 2016, including a sharp increase in overdose deaths among those who are 19 years old or younger. And for a small state like New Hampshire, this is a tragedy of staggering proportions, affecting not just those who overdose, but their families and entire communities. Now, I'm happy to say that in the last couple of years, we've made real progress in combating this epidemic because we've had the Affordable Care Act and its expansion of Medicaid, which has given thousands of Granite staters access to life-saving treatment. Over the past year, I've had a chance to visit treatment centers all across New Hampshire. I've met with individuals who are struggling with substance use disorders and providers who are trying to make sure they get the treatment they need. Last month at a center in the Monadnock region of New Hampshire, I had a really amazing private meeting with more than 30 people in recovery from substance use disorders. They're putting their lives back together. They're hoping to reclaim their jobs, to get back with their families, and they're able to do that largely because of treatment that's made possible by the Affordable Care Act. One patient shared her story with me, and as with so many others in treatment, her story is one of making mistakes, of falling into dependency, of struggling with all her might to escape from addiction. She's in recovery for the second time, and she said that this time for her, it's a life or death situation. She has no family support. She worries that she'll be homeless when she leaves the treatment program. But she is grateful for the Affordable Care Act because it's given her one more shot at getting sober and the chance for a positive future. At a forum in Manchester, New Hampshire's largest city, a courageous woman named Ashley Hurto said that access to health care as an enrollee in Medicaid expansion was critical to her addiction recovery. She'd been arrested following the overdose death of her husband. And Ashley said that an understanding police officer and a drug court were key to her recovery. And she added this, and I quote, "I am living proof that by giving individuals suffering with substance use disorders access to health insurance, we as a society are giving people like me the chance to be who we really are again." Without that access to treatment, where would Ashley be? And several weeks ago, I received a letter from Nancy Feeney, who lives in Concord, the capital of New Hampshire. She told me that the Affordable Care Act had saved her son's life, and this is what she wrote. "My son Benjamin went to Keene State College with the same hopes and dreams many have when building their American dream. While there, he tried heroin. Addiction overcame him, but it didn't stop him from graduating. After graduation, he suffered a long road of near-death existence. After a couple of episodes where he had to be revived because he had taken fentanyl, he chose recovery. And it was due to Obamacare that we were able to get him insured so that he could get the proper help he needed and into a Suboxone program that assisted him with staying clean. In April," she wrote, and you could read between the lines how relieved she was, "It will be a year for Ben in his recovery. Without Obamacare, this would not have been possible. I can't find the words to define my gratitude to President Obama. I believe my son would not be alive today if it were not for this plan that provided the means he needed to get the help he needed at the time he needed it. Ben still has a long road ahead of him, but I will see to it that he never walks it alone." I also want to share a powerfully moving letter from Melissa Davis, an attorney in Plymouth, New Hampshire. Ms. Davis writes, "I'm a lawyer who frequently works on behalf of clients who are suffering from substance use disorder, mental health conditions, or a combination of both. I've been working with these clients for over 10 years, and I can tell you that access to health insurance has always been the biggest obstacle in obtaining quality and consistent treatment. Since passage of the Affordable Care Act and the expansion of Medicaid, my clients are actually able to access real treatment in ways they never were before. Before the ACA, there were far too many times where my clients were unable to afford private substance use disorder treatment. Wait lists at community mental health agencies were extremely long, and AA and NA were not enough. Without treatment, these clients often ended up in jail, or worse, dead. I still have clients who face obstacles to obtaining quality treatment, but the ability to get insurance removes a huge obstacle." Ms. Davis concludes with this warning: "I am sincerely afraid for what will happen to my clients and to my community if access to quality substance use disorder and mental health treatment is taken away from those people who need it most because they're unable to get insurance. Please do everything you can to save the ACA." In dozens of visits to New Hampshire during the campaign, President Trump pledged aggressive action to combat the opioid crisis. In his address to Congress last week, he once again promised action to expand treatment and end the opioid crisis. But despite these bold words and big promises, the president's actions have sent a totally different signal. His actions threaten an abrupt retreat in the fight against the opioid epidemic. By embracing the House Republican leadership's plan to repeal the Affordable Care Act, President Trump has broken his promise to the people of New Hampshire. This misguided bill would roll back the expansion of Medicaid, and it could terminate treatment for hundreds of thousands of people in New Hampshire and across America who are recovering from substance use disorders. Meanwhile, the president's nominee to serve as administrator of the Centers for Medicare and Medicaid Services, Seema Verma, has been an outspoken advocate of deep cuts to federal funding for Medicaid. As we have seen with so many of the Trump administration nominees, Ms. Verma has an underlying hostility to the core mission of the agency that she's been asked to lead. Seema Verma is currently a health policy consultant who has called for less federal oversight of the Medicaid program and advocated for policies expressly designed to discourage patients from seeking care, for instance, by imposing cost-sharing burdens on Medicaid recipients. In addition, she is a staunch advocate of block granting Medicaid and turning it into a per capita cap system. Over time, this would lead to profound cuts to Medicaid, forcing states to raise eligibility requirements and terminate coverage for millions of recipients. And let's be clear who these recipients are. In 2015, the 97 million Americans covered by Medicaid included 33 million children, 6 million seniors, 10 million people with disabilities. Seniors, including nursing home costs, account for nearly half of all Medicaid expenditures. These are some of the most vulnerable people in our society, and they will be the targets of Ms. Verma's determined efforts to cut funding for Medicaid and terminate coverage for millions of current recipients. I also have deep concerns about this nominee's commitment to protecting women's health care. During her confirmation hearing in the Finance Committee, Ms. Verma was asked if women should get access to prenatal care and maternity coverage as afforded under the Affordable Care Act, or whether insurance companies should get to choose whether to cover this for women. Now, Ms. Verma tried to clarify when she met with me that she hadn't really meant what she had said, but what she said was that maternity coverage should be optional, that women should pay extra for it if they want it. Of course, the problem with this position is that it takes us backward to the days before the ACA, when only 12% of policies on the individual insurance market offered maternity coverage. And in the state of New Hampshire, before the Affordable Care Act, you could not buy an individual policy that covered maternity benefits. They were not written. Insurers who offered coverage charged exorbitant rates with high deductibles, plus benefit caps of only a few $1,000s. This is a major reason why, before the Affordable Care Act, women were systematically charged more for health insurance than men. In the eyes of insurance companies, being a woman was seen as a pre-existing condition, and they charged us more accordingly. Well, the American people don't want drastic cuts to Medicaid, cuts that will threaten coverage for children, for seniors, for people with disabilities, and for those receiving treatment for substance use disorders. That's why I intend to vote against the confirmation of Seema Verman to head CMS. Now, in recent years, we've made impressive gains securing health coverage for millions of Americans and significantly improving the health of the American people. And I can't support a nominee who wants to reverse these gains. Excuse me. In recent weeks, all of our offices have been flooded with calls, with emails, with letters opposing the Trump administration's plans to repeal Obamacare and undermine both the Medicare and Medicaid programs. We need to listen to these voices. We need to keep the Affordable Care Act and the expansion of Medicaid. There are things we can do to make it better, and we should work together to do that. But we have heard from people loud and clear across this country. It's time now to respect their wishes, to come together, to fix this landmark law, and to ensure that it works even better for all Americans. Thank you, Mr. President. I yield the floor.